Hello, I'm Dr. Frances Pittsilis. The P-shot is a licensed and trademarked treatment using your own platelet-rich plasma designed for men. Over the age of 45, 50% of men have erectile dysfunction, and of course this can increase with aging, with health conditions like heart disease, diabetes, and with drugs given to men for these conditions and others. It's no surprise that men get distressed about the situation and seek help. There are a variety of things that can help them, including the erectile dysfunction tablets. But some people don't tolerate these tablets, and some people don't like to inject drugs into their penis. Apart from improving internal health to help that chronic illness and perhaps reduce some of the drugs to help erectile dysfunction, there is now the P-shot or the Priapus shot. And what this does is address the issues of erectile dysfunction, but it also helps to prevent further erectile dysfunction. If you like, it may even be used as an early treatment to start to help with maintenance and prevention of the erectile dysfunction that we know will happen with age. And the other thing is that some men develop something called Peyronie's disease, Peyronie's, Peyronie's disease. And this is where you get scarring of the penis that means it becomes bent when it's erect. And of course that makes it difficult to have sexual intercourse. Now all of this of course, affects a man's confidence, their self-esteem and their marriage. So it's no surprise that men go looking for solutions. And one of the potential solutions is the P-shot. It involves the patient numbing their own penis with numbing cream. The treatment is performed by the doctor privately with the patient in the room, and prior to that the patient's own blood is taken and their platelet-rich plasma is extracted. There are 5 tiny injections that are over with quite quickly, and most men state that they barely feel anything. Interestingly, many men who are young and fit report an immediate response that then continues. Sometimes there is an immediate response due to the fluid having been put into the penis, which then settles down and then builds up over several weeks. The effect can be improved further if required if there's another injection within 6 months. In addition, a percentage of men report an improvement in the girth of the penis, and this is because the platelets are stimulating stabilized blood vessels and more collagen in the tissues. And a smaller percentage of men, in addition to this, will also report an improvement in length of the penis. Now, if you've got more chronic disease, if you're a smoker and you're older, it's less likely to be as effective. In young, fit men, I'm talking about 30 to 50 age group, the improvement can be as much as 80% success rate. Now, I have questions and answers about this P-shot. How does it work? Well, the platelet-rich plasma helps to stimulate production of the penile blood vessels and stabilization of these blood vessels. This is because with age, these blood vessels degrade, and that's why erectile dysfunction can often occur with heart disease. The penile arteries are smaller than the coronary arteries. So the local stem cells in the tissues injected are stimulated by the platelet-rich plasma to also be activated and restore tissues. And the overall result is that the tissues are restored to a more youthful state. what is the usual response? Well, as mentioned, about 50% of men get an increase in girth and some also an increase in length. And in fit men, about 80% have success. How many treatments will I need? If one is enough, that's great, but be prepared in case you need 2 treatments. How much growth can I expect? Well, if there is going to be growth, there may well be 20% of girth and length. But the girth seems to occur first and then later the length. And we don't know whether a second injection helps that to proceed further. We just haven't got that information yet. But because I'm a member of an international group doing research, I will be able to update you as soon as I know that information. Is there a risk of scar forming? No, because you're injecting your own tissue into your own body, and over more than 50 years using platelet-rich plasma, there has not been scarring. In fact, we use it for scarring and wound healing, and it's been used in the face for over 10 years and there has not been any scarring. There's more likely to be scarring by using the drug therapy that has to be repeatedly injected into the penis to get each erection. So this is a very safe treatment from that point of view. Can I react to the injection? No, because it's your own tissue and no one has ever reacted over decades. Does it hurt? Well, there might be a slight pinch, but most of the men don't feel much at all. It's a very small needle and pain is minimal, and it's over with very quickly. So, as I was saying, the results of the P-shot include a general rejuvenation of the penis, improved sensitivity of the penile tissues, improved erection and firmness of erection, and ability to attain and keep the erection. There may be some increase in girth and length, and in addition, it may help erectile dysfunction drugs to work better as well. However, you need to remember that the results can vary according to each person. After all, it's your platelets into your tissues, and of course we'll have to see how your tissues respond. In addition to this, in the clinic, we are proud to say that we can help with internal nutritional and vitamin deficiency and help correct hormones. Hormones are not the full deal when it comes to erectile dysfunction, but they are a contributor, and this can be helpful. So here is an innovative, amazing treatment that is getting very good success rates around the world and can really make an impact on a man's quality of life and his relationship.